God forbid anyone had an emergency medical situation here in Homa Bay County, several kilometers away from Aga Khan University Hospital and several kilometers away from Nairobi Hospital, MP Shah, Kenyatta National Hospital, KUTTR8. Which facility do you think we should take anyone in this conference who has an emergency medical situation? As a nurse, the decision for me is very clear. If there's a patient requiring emergency medical services right now, because before AMREF, who are among the sponsors of this side event, show up with their evacuation, my decision would be to take that person, whoever they are, whether it's Anita, whether it's a governor, whether it's a senator, to Homa Bay County Teaching and Referral Hospital. Do you think Homa Bay County Teaching and Referral Hospital is staffed? Do you think they have the required medication? Do you think they have the equipment to handle a stroke, a cardiac arrest? Do you think you as an attender of an event in Homa Bay County is safe with the public facilities there?
Health is provided for as a right in our constitution. Secondly, the government has decided to implement something that is usually in everybody's manifesto as the vision for Kenya for health, which is universal healthcare. Now, universal healthcare means that every human being who is unwell in Kenya should be able to walk to a health facility and get services. People imagine that it means the services are free, but it actually means that we should be able to find the resource necessary to ensure that whether you are in Homa Bay or Garissa, you can walk to a health facility and get services. And the reason our constitution devolved health is precisely to ensure that there is access to those health services, whether you are in Isiolo, whether you are in Kakamega, whether you are in Nairobi.
It is important for us to remember that it takes resources to deliver quality health services. And it's good that we look for synergies that we can be able to put in between Treasury and the health sector so that the challenges that affect the flow of funds can be resolved in a more sustainable way. Otherwise, when the discussion still remains of us versus them, then we are not able to sort out the issues that affect the flow of funds to the health facilities.
Yesterday, the Prime Cabinet Secretary talked about the need for county governments to establish their planning and statistical institutions. And I would want to ask, how many of the counties actually are taking seriously their planning and statistical departments in order to be able to say that the needs of the people in Vihiga when it comes to health are the following in terms of breakdown of the disease types, of the various needs that we need to take care of, and therefore require so much in finances in order for us to deliver.
We've seen challenges in terms of the ability to record and to maintain proper records for revenue received. And it's interesting because this cuts across the on-source revenue and also revenue that is received from the central government through the county governments. And one of the challenges that we've seen is in the oversight component, the staffing, the management, and also the governance level. And the governance level is has to do with the board for the independent entities. I think the expectation is that the entities are supposed to have a board that provides oversight. Then they're supposed to have staff. The expectation is that they should have enough staff to manage the resources within the facilities. Then you're also expected to have experienced staff who are able to do that. What we've seen is that some of the facilities And it is understandable, but I think it's upon the players in the space to ensure even for the facilities that do not have enough staff, there's oversight from a central space. A good example is where you go to a facility that is being served by only one officer. It's the same person who is maintaining the records. It's the same person who is offering the treatment. It's the same person who is giving the services that are required.
One critical thing is to build capacity for the health staff and all those committees that have been established, because they are key in running FIF. Then two, the Kwale example is we allow facilities to retain 100% of their collection. And in their budgeting, we have excluded from it money for drugs, for reagents, and non-farms that is provided for from the exchequer release, so that the facilities can be able to run with the small issues that they can do, and a little budget on drugs, so that before the stock comes, they are able to buy the small supplies that they need. The other issue is what we need to do is to amend the Public Procurement and Asset Disposal Act, so that it allows for facilities to procure from within. Because again, one challenge they have is, yes, they have money, but now they have to follow a rigid procurement process.
I would like to echo what my colleague has said, and I fully agree with him. The issues of facilities retaining 100% of what they collect. And I wish that if that's happening in Kwale, they retain 100%, then the counties support in the major procurements like the drugs, the non-farms, and group. If that happens like to most facilities, I think we'll have tools for us delivering service to our people.
So what we need, as I said earlier, first, let us plan this function properly. Let us look for the data per county. Let us plan with that data. Let us ensure we have adequate human resource. We may not get it in a day. This is a progressive right, but let us, even while we have the limited, let us apply the key principles of people-centered, transparent, and accountable governance. Whether you are an MCA, whether you are a senator, whether you are a governor, whether you are a worker, doctor, a nurse, and so on. And for the citizens, we also need to understand, in my view, we no longer have NHIF. So even as you listen to politicians telling you SHA is working or SHA is not working, you need to realize when you get sick, you'll have to go to a hospital. So my take is, first, register and join and pay SHIF. And number two, let us also be honest. We have many Kenyans who are joining and not paying anything even when they are capable. We have those who are not able to pay, but we have many who are actually lying in terms of their information and not paying. UHC is not free. It has to be paid for from somewhere.
We need to purchase health. Whether you talk it human resource, whether you are talking about supplies, whether you are talking about lab reagents, it is about purchasing health. And therefore, how can we be able to have systems that are efficient, that we don't now again to relook at the Senate to come and oversight us to purchase? They have given us the framework. So this conversation now, we need to move on the efficient use of the resources that have been available to us. For the, I think, Madam Senator, one of the requests that we want to put on your table as we move forward is that there's a lot of conversation around SHA, especially for money for the insured. But then primary health care, level 1, 2, 3, services that are funded through exchequer. The question here is that funds adequate? If it's not adequate, are we still looking that there is a donor somewhere who is going to give us money? No. We need to mobilize the resource. And my appeal is we need to relook at the excise policy, especially the excise policy on the sin tax. I think there are 3 countries or 4 countries which have been able to meet in Africa, which have been able to meet the World WHO standards of meeting the sin tax. Kenya, we are still far. The more we consume alcohol, we produce cigarettes and sugar-based beverages, which are bringing us more non-communicable diseases. They need to pay because they're the ones who are tailing us back to the health facilities. We need to tax them. And we'll be addressing 2 things: mobilizing resources from the tin tax, and then also reducing the consumption of the harmful products. So thank you very much. I know all the conversation that have come from this conversation, we are going to use them to be able to drive the strengthening of the health financing pillar for this particular country. Asanteni sana, and God bless you all.